Hi, I'm Claudia Hernandez, dermatologist. The periocular region serves as a window to a person's chronological age. Periocular problems fall among the most common and difficult complaints to address. Patients are commonly concerned about the appearance of dark circles, crow's feet, eyelid bags, dry skin, thin skin, and just looking tired. They often seek advice about which treatments are the most effective for periorbital rejuvenation. The extent of the problem is reflected in the sheer number of products like concealers, makeup, and skincare that are commercialized to improve, lighten, and camouflage the area. Additionally, with the constant use of face masks with the pandemic, all the attention has been brought to the periocular area. Although aging is inevitable, there are certain features of the periorbital skin that can be addressed to minimize the aged appearance. But let's see it in our patient. Why is the periocular area so problematic and one of the first areas of the face where aging signs appear faster? As we can appreciate in our patient, eyelid skin is unique. It's the thinnest skin in the body, measuring 0.2 millimeters in thickness and therefore shows aging signs the earliest due to collagen loss and elastic tissue loss, which leads to wrinkling, sagging, and more thinning. Eye area skin doesn't have many oil glands as the rest of our face, making it more prone to dryness and lines. Additionally, constant muscular contractions contribute to the appearance of dynamic wrinkles. Evaluation and treatment of the periocular area requires a thorough understanding of the periocular anatomy, especially with respect to the tear trough, a natural depression that extends inferior laterally from the medial canthus to the mid-pupillary line. The continuation of the tear trough is the lid-cheek junction, also known as the palpebromalar groove, which begins at the mid-pupillary line and runs parallel to the orbital rim. Here we have two important ligaments: the orbicularis retaining ligament and the zygomaticocutaneous ligament, and in between, lateral to the mid-pupillary line, we have the suborbicularis fat. The suborbicularis fat ends where the tear trough begins. This area is particularly prone to edema because lymphatic drainage is only performed laterally, with the pump of the muscle contraction. So the three main periorbital concerns are dark circles, eye bags, and wrinkles. So for the dark circles, there are multiple causes. We have the post-inflammatory hyperpigmentation, secondary to atopic dermatitis or allergic contact dermatitis. These patients constantly rub their eyes. We also have the periorbital edema, the increase in melanin and hemosiderin deposition, and we have also the increase in visibility of the blood vessels due to the aging process and the increase in skin laxity. The causes for eye bag formation are multiple: eye fluid accumulation, orbital fat prolapse, lower lid skin elasticity, orbicularis prominence, prominent malar mound, and formation of the tear trough deformity. Regarding treatment of the periorbital concerns, periorbital rejuvenation is an important part of restoring overall youthful appearance. Treatment of dark circles will depend on the most important characteristics. For pigmentation, topical non-hydroquinone or low hydroquinone plus peelings is a first choice. In case of photoaging symptoms, we need to focus on bleaching ingredients with collagen-stimulating properties like retinol, niacinamide, ascorbic acid, and antioxidative effect like resveratrol. When we have dark circles that are associated to structural problems, we need to focus on other procedures. Skincare will be complementary, so we need to think about autologous fat transplantation, fillers, and also consider blepharoplasty. Dark circles can also be a combination of different factors, and that we can have a mixed problem in the periorbital area. So depending on the leading mechanism, we're gonna give our treatment. Topical treatment is the important part of any strategy, particularly for hyperpigmentation and dark circles. For the topical treatment of dark circles and periorbital hyperpigmentation, we can consider different active ingredients depending on the severity of the problem. So for mild cases, we must consider retinol and niacinamide. For mild and to moderate cases, we can consider hyaluronic acid, antioxidants, arbutin, and caffeine. For moderate cases, also consider niacinamide and vitamin E. Additionally, for eye bags treatment, most of the mentioned ingredients should be also considered. Going more into detail into these active ingredients, we know that hyaluronic acid has hydrating properties. So hyaluronic acid can increase the hydration of the epidermis, and it can also increase the penetration and transportation of other active ingredients. To consider antioxidants as epigalloctocin galate that improves fine wrinkles, induces light depigmentation effect, and also skin hydration support. And additionally, it has an anti-inflammatory and anti-redness effect. To treat hyperpigmentation, we can consider bleaching and depigmentating soft agents such as arbutin at 2%. Ingredients such as caffeine at 5% can increase the drainage of the periorbital area, can fight against swelling around the eyes, and also it can constrict the veins. Another important ingredient for the treatment of periorbital concerns is niacinamide at 10%. Niacinamide has antioxidant effect, depigmentating effect, anti-photoaging effects, and it also improves the skin barrier. Retinol at a concentration of 0.5% can improve wrinkles, can induce collagen synthesis, has an anti-photoaging effect, and also it can improve vascularization. Tocopherol or vitamin E at 1% concentration has antioxidant effect. It can enhance the efficacy of retinol and niacinamide, and it can also increase regeneration. It's important that we are able to customize the treatments, thinking always on the needs of our patients, and also thinking that the treatment is not unimodal, it's a multimodal approach where we can mix skincare with also additional procedures for our patient to treat the periorbital area.